Uh, I'd now like to tell you a little bit about the project. We are a little bit tight as far as time is concerned, but I will hopefully share a few slides with you, which will give you the context and give you a little bit of information about what is it that we have come up with. So we've been talking in the Indian press, there's been a lot of talk about the silver tsunami. And when I sort of read this term, it made me feel that, yes, of course, there is something about the reality of what is going to hit India soon and has already hit India in terms of numbers. But when you talk about a tsunami, you usually talk about something that is destructive. And I'm trying to think that could this be an opportunity? Could this be a wake-up call for us to say that in 2050, there's going to be a crossover. And the number of young people under the age of 14 is going to be surpassed by the number of older people over the age of 60. So this changing demographic has happened in many other countries and is soon going to happen in India. And are we prepared for it? So there are 120 million people over the age of 60 in India at the moment. So that's 10% of the population. Now, of course, any percentage of the population of India is a huge number already, but this is projected to rise to 354 million by the age of 2050. So that will be 20% of the population. So this increased longevity, whilst it's celebrated because it's due to better healthcare, even though it may not feel like on the ground, but there is definitely more healthcare, there's better healthcare reaching even the people who are poor, and the reduction in poverty and also lower birth rates. So average life expectancy in 1947, when India gained independence, was 32 years. Now it is 68 years and rising. So what is the need? Now, 82% of senior people live in their own homes, and actually a much higher percentage are actually living with somebody else who's a family member or with a relative. But 82% are actually living within the context of a joint family or some kind of a community that is looking after them. We also know that healthcare complexity is rising everywhere, all over the world, and including in India. So people are living longer with more complex difficulties. We also know that family and paid caregivers need skills and support. Nobody realizes or nobody prepares for the fact that somebody in their community or their family is going to get old, they're going to need help, and how are they going to help them? I spoke to my aunt who actually spent many years looking after her elder aunt. So these are my mum's sisters. And I asked her what was the one skill she felt that carers needed to have. And she said, if you can't teach them or show them or train them in anything else, train them in compassion. So care, compassion, communication skills, all these are absolutely vital when we're talking about dignified caring for senior people. We also need to remember caregiver well-being, because caregivers are often young people, they're usually women, they're usually doing this for money, and it's very often forgotten that their own well-being is also so important. And how we employ them, how we make them work is really in our control. We also know that medical models don't work here. So the typical data gathering, history taking, investigation, diagnosis, treatment model, which of course, as doctors, we know very well, seems to stop when the patient is discharged from hospital. And then when the patient goes home, or the elder person or senior person goes home, it's very much left to the family to work things out around how they're going to look after that person at home. So we wanted to do this really to empower families, and we felt that families have the greatest vested interest in something like this, and they would then transmit some of that information, education, and training resource to the paid carers that they employ. So another reason for the need is that children are moving away from home. We want our children to do well. We want them to fly the nest. And of course, we as children ourselves have flown the nest and gone outside the country. And this is a reality with lots of families. So the decline in joint families, a rise in nuclear families. How do we address the care needs of people as they're growing older when their immediate family are not in the same city or the same country. We've already talked about paid caregivers not having the skills. And one of the things that has really struck me is that the expertise around care, and this is also true for nursing care. It's not only the care at home. The expertise around nursing care and care at home has not kept pace with medical expertise in India. We know that in India, you can get all the latest investigations and indeed treatments that are available in the rest of the world. But I think we need to be a little bit more ambitious and aspire for the same care that some of the other developed countries of the world are aspiring to, or indeed have with them at the moment. Now, I must say that there have been a lot of initiatives by the Indian government to address this issue. There are lots of reports that are coming out. There is the India Aging Report that came out in 2017. There's a longitudinal aging study in India that came out in 2020 based on some work that was done in 2017 to 2018. And these documents make very interesting reading. We have had a couple of reports, there have been lots of reports, but these are the ones that struck out for me, that there has been some attempt to try and understand what aging means for India. And I know that there have been a lot of initiatives that are underway, both in the sort of government sector and the private sector. There are lots of private initiatives, of course, mostly around care homes. But we're not talking here about care homes. The Prem Seva project is about home care. It's about empowering families, about supporting families at home when they find themselves in this situation. They're looking after a senior person at home, and there's no support, there's no advice, and there's nobody to tell them what to do, how to do it, where to look, and who to turn to for support. The incidence of disability. Now, disability is defined as any senior person needing support in the form of their activities of daily living. And there's something called instrumental activities of daily living, which means that they are needing support, which requires some kind of intervention, some kind of a device is required. And it doesn't have to be a very complex, it could be just a wheelchair, but that is called IADL. And if you read the documents, you will see that there is quite a lot of detail gone into. Now, some of this is ascertained, I think. We don't have all the figures, but we can see that after the age of 60, and the men and women are very, very similar in their percentages, the incidence of disability in people, senior people, rises quite dramatically. So by the time people reach the 80s, and fortunately, at the moment, there are not very many people in the 80s. I'm saying fortunately only because we don't have the resources at the moment to look after people who are much older. But given the fullness of time, I think we need to be able to help people even as they're getting even in their 80s and their 90s. So we do need that. We do need to understand that there is going to be an increasing requirement for this. So what is Prem Seva, and what is Prem Seva hoping to address? So Prem Seva is an online information and education resource. We have a website, which please feel free to log on to the website. It's up and running. The apps are still awaiting approval. They are ready, but you may have some difficulty getting onto the app. If you've been able to successfully get onto the app, that's brilliant. The app and the website mirror one another. And what we've tried to do is have resources available that will help you provide practical and compassionate care for senior people at home.